Right now, I work for the American Music Therapy Association, which is the organization that supports the development of music therapy. I'm their director of professional programs. So what I do is answer lots of questions about the career path in music therapy. Um, I have a bachelor's degree in music therapy from Anna Maria College and a master's in music ed from the University of Connecticut at Storrs. So what I'd like to do is share my screen now. Enough about me. See if I can do this. Juan, can you allow
Yes.
me to share? Okay.
Very hard.
Okay. Let me see. Wait. Okay. Okay, can you all see that?
No.
Can you see the slide?
No.
No? Okay. Okay, hang on. Oh, do I have to pick it from here?
Yeah.
Oh, okay. Okay. Okay, let me start the slideshow.
Yeah.
Here we go. Okay. Okay, so what I thought we would start with is talking about music and human beings and some universal truths that I believe we all share. Humans respond to music physically, emotionally, cognitively, and spiritually. Music as an art form has been present in human history since ancient times. And music is an integral part of every culture and used in life rituals, birth, marriage, death, sports, celebrations, and certainly self-expression, as in all of us participating in the band. Also, music and human beings, also true, is that music provides physical and emotional stimulation. It facilitates social interaction. Music provides communication. Music evokes associations. Music provides diversion from medical procedures and hospitalization. The concept of music and healing is certainly not new, even though music therapy came into being as a profession in the 20th century. The concept dates way back to ancient times, the early Greeks, shamans, healers, and all cultures. Aristotle, for example, believed that music had cathartic effects and could provide relief from negative emotions through catharsis. Basically, all the ancient peoples recognized the connection between music and behavior. Ancient Greeks actually also believed in all of the modes. For example, the Dorian mode would cause persons to become reasonable and contemplative. And there were even some modes that were advised against being played because they were too excitable. They would get people too excited. So now we jump to the 20th century and World War II and veterans hospitals. And that's where essentially music therapy has its roots and its beginnings. Right after World War II, community musicians of all types, amateur and professional, went to VA hospitals around the country to play for veterans suffering from physical and emotional trauma from the war. Hospital musicians provided music for the soldiers to boost morale, the rehabilitation of leisure skills, and physical and emotional function. In fact, doctors and nurses, seeing the beneficial effects of music, realized not only the importance of what the musicians were doing, but also the need for musicians to be trained, that this wasn't just, this went beyond entertainment. So music therapy grew into a recognized profession in 1950, actually, with the advent of university curricula and the birth of the American Music Therapy Association. The Michigan State University was actually the very first university in the United States to have a bachelor's degree program in music therapy. And in the 1960s, the University of Kansas was the first school to offer a master's degree in music therapy. And from there, we have now 89 music therapy degree programs nationwide, a combination of bachelor's, master's, and doctoral programs. So what is music therapy? So it's an allied health profession similar to occupational therapy, speech therapy, and physical therapy. Music therapy is also considered an allied health, is a creative arts therapy, like art, dance movement, psychodrama, poetry. And it's also considered a complementary therapy, which would be supportive therapies, again, in that allied health area. Music therapists work in partnerships and on interdisciplinary treatment teams with physicians, with nurses of every specialization, social workers, and other allied health professionals. The kind of team that music therapists work on basically depend on where we work. For example, music therapists in a hospital setting would work largely with doctors and nurses. In a school setting, it might be a school counselor, teachers, also PT, OT, speech. So it depends on the setting. The definition of music therapy, this is one I like from Dr. Ken Bruscia, who is a major figure in the music therapy community as a clinician, researcher, and educator. And his definition is, music therapy is a systematic process of intervention wherein the therapist helps the client promote health using experiences and the relationships that develop through them as dynamic forces of change. So what does that mean? It means that music is used as a tool to help people of all ages experience significant and lasting improvements in physical or emotional functioning. And so that includes areas of psychological, cognitive, behavior, social, takes in all those areas. And so we are talking about live music making with a variety that can be singing, it can be playing an instrument, it can be moving to music, it can be listening. It is that process of making music that is the crux of music therapy and how it works. So further of how music therapy works, music therapy is directly connected to brain function. Music stimulates all areas of the brain. It is a multisensory experience. We hear music, we see musicians playing, we experience it tactily. Playing and listening to and creating music involves practically every cognitive function. And neuroplasticity, which is the ability of the brain to adapt to change, is one of the ways music therapy works, in that music can help make changes in the brain. So for example, specific elements of music can be used to stimulate change in targeted regions of the brain. So if we were talking about rhythm, for example, and we look at the little picture of the brain that I have, in the frontal lobe, which is kind of the large tan section, the frontal lobe controls movement. So if a music therapist were working with someone, say, to help them learn to walk again after an accident or illness such as a stroke, the music therapist would be using rhythm and targeting that area of the brain. Also, even though the frontal lobe controls movement, the cerebellum, which is located near the brainstem, kind of the little green piece there, the cerebellum fine-tunes movement. Essentially, the cerebellum is responsible for balance and fine motor movement. So balance also important for being able to walk. So I'm just describing some of the elements of music therapy, which makes specific use of music and or its musical elements. So that is, as we know, tempo, rhythm, melody, harmony, texture, and timbre. And again, is in a process designed to facilitate or promote learning, mobilization, expression, and or organization. Again, the same under those same areas: physical, emotional, mental, social, cognitive, and spiritual. So what we do as music therapists, we don't diagnose anyone, but we assess strengths and needs. We develop specific music therapy programs, activities that address short-term and long-term goals. And then we implement that program to address those goals. And then we collect and document data related to client responses and progress to make decisions about music therapy services. So the kinds of activities, say, that would be involved in music therapy programs would be, say, music improvisation, music and imagery, songwriting, lyric discussion, music-assisted relaxation, adapted music lessons, and learning through music. Typically, music therapists use all styles of music and play a variety of instruments depending upon client needs. Meeting the client where they're at is essentially what we do. So we start with songs that, or music essentially, that a client is familiar with and can relate to, and then go from there. So sample goals of music therapy in the area, say for developmental and neurological growth, that would be one large goal area. And then our specific goals would be improving muscle coordination, improving coordination, improving muscle strength, building brain-body connections through neuroplasticity with the elements of music, as I described earlier. Another goal area might be psycho-emotional regulation, which would be specifically objectives would be to decrease agitation and anxiety and reinforce positive behaviors. This would be true of older adults who are experiencing forms of dementia. So now I'd like to show you a little bit of music therapy in action. I have a few clips of music therapy, which will hopefully help understand what I've been talking about. This first clip, you're going to see a gentleman in a rehab setting who was working on gait training. He was recovering from a pretty serious car accident. So in this clip, you will see them describe what is happening, and then you'll see the work going on. Can everyone see this? No? Okay. Okay.
Jane, sometimes you have to leave and then go back to it.
Okay. Actually, let me access it a different way. I'll try accessing it a different way. Let me stop this. Let me see. Let me screen share again. Okay. Let me go. Let's see. I think this should be it. Let's try this. All right. It worked in the practice. Okay, this is actually, okay, this is a different, actually a little bit longer, talks about music therapy in hospital settings. Can you see this? Everyone see this?
We see it through your screen. Yeah, we see it.
Yeah, but the sound, I don't think, you have to make sure that you are sharing the sound as well.
Okay. Okay, should I try it? Let me see, a new share.
In the Zoom, down the buttons, you have the share the screen, but you have to click on the share the sound as well.
Okay, okay, gotcha. Thank you. Okay. Okay. Now this should work. Okay. Oh, I'm sorry. I'm sorry, I'm not sure why it's taking so. Let me try another one. Let me go back to, okay. Okay, resume share. Oh, I'm sorry. Let me see if this works.
If not, Jean, let's try something. Can you post the link on the chat, and I will open.
Yeah, you know,
And I will open, and then I will share my screen.
oh, okay. Okay. Okay, I'll do that. Okay. Okay, let me see. Okay, resume sharing. Okay. Let me try sharing. Can you see my screen again?
Not yet. I'm seeing the Google.
Okay. Okay, it says stop share. Okay, stop share.
There. Now you
Okay,
stop.
let me try sharing it again. Okay, I'm sorry. Let me try sharing it again. I'll just share my screen. Here we go. Okay. So let me, let's see. Let me just move on and then we'll come back to this. Yeah, let me just move on. Sorry, sorry. Okay. Okay. So I'll show you pictures of some music therapy in action. And you see music therapy with some children. You see someone, a young adult singing, and someone undergoing a hospital procedure. So who do music therapists serve? We serve individuals from cradle to grave, essentially all ages. Can you see my screen?
Yeah.
Can you see you
Yes.
can see it?
Yes.
Okay. Okay. Where do music therapists work? We work in a large variety of different settings, medical and nursing homes, schools, hospice settings, correctional and forensic facilities, private practice, daycare treatment centers, substance abuse programs, wellness programs and community settings, and many others. The most common populations that we do serve are persons with autism, developmental disabilities, persons with behavioral and mental health concerns, rehabilitation and habilitation, that would be stroke, premature infants, also chronic conditions such as Parkinson's and other forms of dementia. Everything that we do is evidence-based and is backed by research, over 70 years worth of research to document the beneficial effects of music therapy. So everything that we do has a research basis for it. So what are the different skills that a music therapist has that someone who is a performer or a music teacher might not have? And that would be training in observation, assessment, documentation, and applied clinical research, training in interdisciplinary treatment team processes, health and education systems, relevant state and federal laws like HIPAA, IEPs, and various reporting laws. Other skills, we have significant clinical training in application of psychological, neurobiological, and psychoacoustic processes, approaches and processing, use of theoretical approaches as the foundation of music therapy interventions. So this would be more psychological as in behavioral, humanistic, psychodynamic. The coursework for music therapy degree is a music degree, a 4-year, actually a little more than 4 years, bachelor's degree in music. Right now we have 89 accredited degree programs in the United States that are bachelor's, master's, and doctoral, accredited by AMTA. The courses are divided into the following general areas. Music foundations, which are all the music courses, that's theory, ear training, conducting, arranging, ensembles, private lessons, and then the clinical foundations, which would be courses in psychology and science, and one course in anatomy. So basically everything that's needed to understand clinical process and a therapeutic process. Music therapy foundation courses are basically the core, the professional core of the degree. So those are all the courses that will teach the techniques, the methodology, the theory behind using music in clinical settings. There's also a clinical training component to the degree. Some of the music therapy courses have have components where there's a practicum or field work. So a student is working with a music therapist with a specific population. And then the capstone experience of the degree is an internship between 1,020 and 1,040 hours. So it's a 120 credit degree with 1,200 hours of clinical training. And then there's a small component of general education. Most of this degree are required courses, about 5% are electives. There's also coursework at the doctoral and master's levels. There's also specialty training available, and these are not associated with the degree. These are separate, essentially to provide extra skill sets in neonatal intensive care, neurologic music therapy, hospice and palliative care, and guided imagery and music. And for guided imagery and music, that is the only area basically where much of the interaction is with recorded music, because guided imagery and music is more of a psychodynamic area where the music therapist is essentially putting someone in an altered state of consciousness through music. What is required to practice professionally? A credential is required to practice music therapy. Graduates of music therapy programs take a national board certification exam, and then if they pass the exam, they get the credential MTBC, and that is what is necessary to practice professionally. To maintain the credential, 100 hours of continuing ed is required over a 5-year cycle. Music therapists generally carry liability insurance. Certain subspecialties require supervision hours. That would be something like guided imagery and music and some mental health settings. And our profession is also bound by standards of clinical practice and a code of ethics. The American Music Therapy Association, the mission is dedicated to the advancement of the public's awareness of the benefits of music therapy and increasing access to quality music therapy services for those in need. The American Music Therapy Association represents approximately 9,000 credentialed music therapists in the US and around the world in over 30 countries. AMTA's purpose as an organization is to support the progressive development of the therapeutic use of music in rehab, special education, and community settings, which I showed you before. AMTA is committed to the advancement of education, training, professional standards, credentials, and research in support of the music therapy profession. This year, AMTA celebrates 70 years of music therapy in the United States. We have 2 research journals. One is the Journal of Music Therapy, which is published quarterly and contains qualitative and quantitative research. Music Therapy Perspectives is the other journal, which focuses on current methodology and practice and is published twice a year. I'm a music therapist, and what's your superpower? And for any questions, I'd be happy to take questions. More information can be found on our website, musictherapy.org.
Jean, if you still want to share those videos, you can send it to me, the link, and I can share my screen. I think that's gonna work.
Yes, I would like to do that. Yes.
Yes, you can put it in the chat, and I will just click there. Just cut and paste the link, and I will open it.
Okay. Oh, here we go. Okay. Let me see. Okay, so you said, how do I do this one? I just,
In the chat, you
I
can
put it in the chat. Okay,
yeah,
okay. So I
chat.
can stop sharing to do that, right?
Yeah, no, just copy and paste. You just have to write it as a message.
Okay, okay. Let's see, I'll go ahead and do that. Okay. Okay, let me put it in the chat.
Mhm.
Okay. Great. Okay. Oh, there's one of them. Okay, great. There's all three. Okay.
You send it to somebody else. I don't know who. Make sure
I put it in the chat. Oh, okay, hang on.
you send it to me or to everybody. I will be the only one open it.
Okay, got it.
I got it.
Okay. Ah, okay, great. So this first one is Mark in the learning how to walk again.
One more. Good. Straight.
Oh, good try.
That was awesome.
Yeah, do it again.
Yeah, there you go. Good, one more. Awesome.
Oh, wait a minute. Whoa.
Yeah, get your balance.
Yeah.
That's the end of that one.
Good job.
The second, if you want to click on the second one, Juan,
Yes.
This- using melodic intonation therapy. So this is a stroke patient. Just quickly, melodic intonation therapy basically is, it emphasizes the melodic patterns that exist all in normal speech. And then the approach takes advantage of the undamaged right hemisphere of the brain by engaging areas that are capable of language. So it's music is processed actually all over the brain, but also in the hemisphere. You'll see. This is used.
Våt. Ja, våt. Våt. Hello, 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 hello. I am Jews. I am Jews.
What's your name?
I am used.
And then the last video is music therapy in a hospital setting. This one is a few minutes longer. So this one has a few voiceovers, and you see music therapists working with children in a hospital setting. This last one. And it's actually was put together by the Berklee College of Music, which is one of our approved bachelor's degree programs.
Welcome to what? To what? To music. Music. That's right. Hello, hello, and welcome to music. Hello, hello, to you, and welcome to welcome to music. And I think that music, especially with Pablo, does have a way that transcends the physical limitations that his body has. He really gets beyond the fact that he is a sick child, and he's just Pablo. And Pablo loves music. What can you do with the instruments? Let's hear you play. What can you do with the instruments? You play them in your own way.
Music therapy is an art, but it's also a science. Its effects are being documented in research across the country, around the world. Music therapy, when used in hospitals, helps people cope with illness. There are actually many, many symptoms that are ameliorated through music and the facilitation of a music therapist. In cancer patients, the symptoms of nausea, often associated with chemotherapy, have been reduced when people use specific music therapy techniques to focus their attention on the music rather than what's going on in their own bodies. Music therapy can help decrease anxiety, which then affects blood pressure, affects heart rate, and can help prepare the person psychologically and also physically for surgery.
Music affects us so deeply. Music therapy, I think, tunes us in with a whole different range of experiences. A music therapist working with a patient in that relationship is able to model the universal striving for elevating the human experience that one finds in music making and in music appreciation. When we suffer, we need to be cared for. Very frequently, there isn't time to attend to the side of the equation which addresses our humanity. And I think that this is where music therapy comes in.
I perceive music therapy as another form of integrative therapy that helps support patients, cancer patients, patients with chronic disease, as well as people who are just dealing with everyday stress and strain. It's alongside of conventional therapy. They're being used together. For example, using music therapy alongside of chemotherapy for a child with acute lymphocytic leukemia. It helps the child, it helps the staff, it helps the family. It reduces discomfort. There's good evidence to show that these integrative therapies, these complementary, these supportive therapies are reducing symptomatology.
I think music therapy is a wonderful discipline.
To the sound.
After hundreds of years of realizing what kind of an effect music had on human emotion and even on human physicality, we've started to say, how can we take music and customize it to have a specific effect to deal with a specific person's set of problems? And I think that's so very exciting. It allows the music therapist to do something I can't do, that is to address individually the needs of the people that are in their care.
I believe in music. I believe in you and me.
Well, thank you everyone for listening.
Thank you, Jane. I'm pretty sure that we have many questions. So if anybody wants to ask, please unmute yourself and go ahead. Laura, that's your cue.
Well, I do have one question, Jane, actually, and I've been trying to think how to phrase it, which is, from my experience, we don't hear much about music therapy when we hear about someone who's in a hospital with a stroke. We hear about their physical therapist and their occupational therapist and maybe their talk therapist, but we don't hear about this, and yet this seems like such a natural thing that we should be doing. So I found myself wondering, do you face that in your career, that people are not thinking about this? And then my other side of the question, or is this just something that's growing and becoming more commonplace?
It's actually a little bit of both. Music therapy, the visibility of music therapy has been something that AMTA as an association has been working on for many years. Because we're small, music therapy is not present in every state, and there are thousands of hospitals, and there are largely 9,000 of us, and there's about 60,000 OTs and PTs. So our presence is not as great, as because it's sheer numbers. However, there has been more visibility about music therapy over the years, in print media, also in specials. Like Gabby Gifford gave music therapy a real boost when she received music therapy as part of her rehab after she was shot. She got her speech back. So it is a little bit of both. It's where we've certainly, as we grow as a profession, we're getting more visibility because there are more doctors that are partnering with music therapists, seeing the work and seeing what we do and wanting to have more. So right now we're enjoying more visibility, but it's something we work on all the time to help people understand what music therapy is, and basically continue to expand music therapy practice.
I have a couple questions. Have you had any luck with people who have completely lost their speech as a result of a stroke or Alzheimer's? There
are music therapists that have worked with Parkinson's patients, I'm not, and there are various degrees of where their speech is. Their music therapy has been successful in helping people with aphasia to regain speech to a large extent. Also, people with dementia music therapy. Music therapists work a fair amount with people with older adults and people with Alzheimer's and other forms of dementia. One thing that has worked in addition to speech has also been rhythm. Playing in drum circles actually has been incredibly helpful for people with Alzheimer's. Basically, the repetition of the rhythm has been something that has been found to be really good. So yeah, there has been some success where research points to.
I mean, how does somebody, I mean, I have people I know who don't live here, but I mean, how does someone get a music therapist? Because, you know, if you're at home, I mean, I have not seen the readily availability of music therapy in my experience in nursing homes and
Right. Well,
places like that.
people usually call us. We can provide referrals for music therapy services. So generally people will call us at the national office and ask for referrals. That's one way. And then we can connect them with music therapists around the country. Sometimes, you know, there might not be music therapists in the facility, but there could be one nearby that would provide services. So typically we try to connect people with services.
Is it expensive? Is it covered by insurance?
Some of it is covered by insurance. We are not as across the board covered as OT, PT, and speech, but there are some major insurance companies that do cover music therapy. There are also some CPT codes, which stands for current procedure terminology, which doctors use, physical therapists use, that, and some our music therapists have been provided with some CPT codes, so we can bill insurance companies. Some music therapy is private pay. It basically depends. In some states, there are Medicaid and Medicaid waivers that cover music therapy services. There's essentially probably a range is typically music therapy. It's the average fee is probably between $50 and $60 an hour. And that, you know, can change depending upon area of the country, although but that's probably about an average.
Thank you. That's
Thank you.
Jane, do you have a number of an average number of people that are currently graduating each year from any of those degrees?
Yeah, that's a good question. Let's see, off the top of my head, we probably have, I'm prepared for this, close to, let's see, the average music therapy, let's see, 89. You know, I'd have to actually, off the top of my head, I'm not sure.
It's fine. I just
the number of music therapy students really fluctuates. We have music therapy degree programs in really large universities like Florida State, like University of Kansas. We have, and then we have music therapy degree programs in very small private schools, you know, so you could, it's like Berkeley, for example. Berkeley has their average class size right now, they have enrolled probably about 150 students in music therapy. And then you have programs like, say, Alverno College in Wisconsin that has maybe 20 music therapy students because they're a small private school. So there's a wide range of students.
Yeah, we have a comment there in the chat saying that also the Johns Hopkins has a great center for music and medicines where they are integrating music therapy into the hospital. And we have a link
They
there.
do. They have a music therapist on staff. They do not have a music therapy degree program. They do have a Center for Music and Medicine. We've been working with them because they are interested in establishing actually a master's degree program in music therapy, which we would very much support. Right, but they do have an interesting, they're working, the Peabody Conservatory is working with Johns Hopkins Hospital. So they are essentially, there's a music therapist there that's kind of monitoring music students going into the hospital and playing for patients at the bedside, which is specifically not really music therapy, but it is something that with supervision, some students can do. Like I said, we're working with them in the hopes that they will want to establish a music therapy degree program.
We have another question in the chat. It says, you may not see it. It says, how music therapists know what type of music or what genre of music to use if the patient can't speak?
if the patient can't speak.
Yeah.
Typically, it's not too difficult to figure out the kind of music a person likes. So like say if it's depending upon the age of the person, a music therapist, say might ask a family member kind of what, if the person can't speak for themselves, what kind of music they would like. And then a music therapist would start with that. And then essentially, and then go from there. So older adults, might enjoy, say, jazz standards or spirituals. But if the person can't speak, the music therapist, if someone can speak for themselves, then they would typically, let the music therapist know what they like. Typically, a music therapist, would again start with the music a person knows.
Yeah, I would assume that the therapist needs somehow to profile the patient to know
And
before
that's
you.
typically, and that typically happens like in the assessment. There are ways to find out what, the music interests and likes, and a music therapist would use a variety of music with a person in an assessment initially, before a treatment plan would be put into place.
Okay, another good question. Do you also work with the military, like music corps?
Actually, we do work with in VA hospitals. We also work with soldiers returning home and reintegrating into their families. There are other programs like the Wounded Warriors that work on songwriting with vets. So we have some connection with that. But we also, veterans are a population that music therapists do work with.
Another one says, do you know if music therapy is practiced in Europe or Asia, and what is being found there?
Yes, actually, music therapy is practiced pretty much worldwide. There's the European Confederation of Music Therapy. There's the World Federation of Music Therapy. There are music therapy organizations in most of Western Europe, in Asia, Japan, Korea, China. There are music therapy associations in India. That's more emerging. But there are places pretty much all over the world that have music therapy. Most of the degree programs in outside the United States are master's degree programs. Essentially, many music therapists from the United States go to Europe to present. People from Europe come to the United States. There's a lot of interaction worldwide in the music therapy community. AMTA also hosts a free journal on their website called Voices, which is an international music therapy journal, and it's free. So it's packed full of information, great articles about music therapy practice around the world. But
I can tell you that in Spain is a big thing, actually.
Yep.
It's one of this probably the last 10, 15 years, it's seen so much growth in music therapy, and all the programs are master programs. We don't have undergrad there, but we have masters, and
right.
And it's a master of 3 years, really competitive to get into, and really tough to do it. Yeah. Another one we have here is music therapy directed and applied in a one-on-one manner, or is also in group settings?
It can be small group settings. Typically, music therapy is either one-on-one, two-on-one. It can also be in small group settings. Typically, there's not large group settings if you're working on clinical goals, because it is too hard to track a goal with more than, say, a group of 6 or so. So for clinical work, it is small group or individual. Sometimes music therapists will host drum circles if they're working on wellness, which will be large groups of people, and then the goal is essentially not so much a clinical area, but it's wellness in general. So so more recreational music making, but again, beneficial.
Okay. Any other questions?
I have a question.
Jane.
If you have someone coming into like a nursing home setting, like my mother-in-law is a resident at Ingleside at King Farm in the memory care unit. She's got advanced dementia, and they occasionally have, not so much now with COVID, but they did have a pretty regular program of having someone come in to like just play for the resident. Is that considered music therapy, or is that?
No, That, I mean, that would be entertainment, that which is great because that does have a therapeutic value. It would not be music therapy in that there would not be clinical goals attached. If it's someone coming in playing for folks, that's great, and that's providing that's providing
Just
entertainment.
giving them some stimulation, basically.
Exactly, giving them
Yeah, okay.
stimulation, giving something to focus on. Sometimes people will run sing-alongs, you know, which is all great. But there are music therapists too there's a music therapist that works at Riderwood, like in the memory care unit. So more places in the area are, you know, hiring them. Yeah.
Okay, thank you.
We have another one. Is there any evidence that music can reach people in a coma?
There is some evidence. I am not as well versed on specific studies, but there have been some studies with music therapy with reaching people in a coma. To be honest, I'd have to look that up and get you specific citations.
Any other questions?
I have a question.
Yep.
By the way, my son's undergrad school has music therapy program. It's College of Worcester in Ohio. It's
Oh yeah, College of Worcester, yeah.
Small program, but they do graduate people every year. What can you describe a little bit about an example of how it's music therapy is used with people on the autism spectrum? That's not an illness that needs to be cured. It's quite a spectrum. I have one kid on the spectrum, but there's different, you know, the spectrum. So I'm just curious how it's used, you know.
So music therapy typically is used a lot with communication. Typically people on the autism spectrum have a hard time with communication. And so music therapy is used in that way. Social stories, typically sometimes also coordination, proprioceptive type things. That's where essentially music therapy can work on the spectrum. There's a lot of various goal areas. Also learning, you know, specific a transition. Sometimes music therapy is used with transition. Oh yeah.
Is the music therapy ever used in a psychological situation? Is when you have emotional issues as opposed to physical disabilities?
Yes. Yep. Many music therapists work in mental health settings, from anywhere from inpatient psychiatric to community mental health, outpatient. And that can range in mental health from working on things like anger management, working with people who are schizophrenic, who have various mental health diagnoses, working, right. So yes, music used in that way too. So a music therapist might use songwriting, you know, for a person working on mental health issues, especially say anger management or depression, might be lyric analysis, something like that. Lyrics of a song where they're talking about the lyrics, writing songs.
I have a question. Based on the person who's asking the question about the coma, when my mom was passing away as well and was, I guess, sleeping as she was passing and didn't speak verbally to me, they told me she still could hear things. That we're both music teachers. So I did play my flute as you know, as she was passing and asking her shit. But I was wondering too, do you know anything, like, do they really hear you with the music, even because they can't process to speak to you, and they're based on the question that the person was just asking?
They can, there is evidence that they can, and there are music therapists who do work in hospice settings.
Yeah.
Will be at the bedside, something with the family and playing music. We sang to my mom, essentially the day before she died. She went unconscious, and, you know, we sang songs, and I, you know, I would definitely think she heard, you know, she understood, she could hear it. Typically hearing is the last sense to go when someone is dying. So that's the evidence, from the evidence we have, music is effective. And then music therapists working in hospice will also sometimes make a recording, you know, for a family to have as, you know, as a memory of the experience and of the loved one.
Mm-hmm. Well, because of the COVID, hospice was not allowed into some facilities.
Right, right. Yep.
Yeah,
Yeah,
it was neat. It was neat.
under normal circumstances, they would be, right, right.
Yeah. And actually the nurse told me to tape it. So, because I felt like, oh, I'm allowed to do that. But I did because the staff told me that I could. Yeah. So I did.
Yeah, that's great. That's great.
I was wondering, like, would she know? But I guess they do.
Oh, I'm sure she knew.
Thank you.
Anyone else? All right, before we finish, and before I thank again Jean for being here for us, it happened that today I came across this video that I would like to share with everybody. I don't know, maybe you've watched it on Facebook. It's around these days, and it has to be probably with music therapy as well. I'm gonna share it. It's just 3 minutes.
Oh yeah. Beautiful.
She was the first ballerina of New York, and they put that music for her, and she remember right there all the moves. All right, Jean, thank you so much. I think everybody enjoyed this, and I'm so glad that you had this time for us.
Well, thank you. Thank you for spending. Great to be here.
Absolutely. Thank you very much.
Thank you.
Thank you.
Thanks. Thank you.
All right, I'm gonna stop the recording now.